57 years old male suffering from the left upper GB ulcer since last 3 months. Biopsy proves it's a well differentiated squamous cell carcinoma. CT scan shows the size of the ulcer is 16 millimeter by 20 millimeter, and the depth is 7 millimeter. So the decision to have a PET CT was taken. PET CT shows the disease limited to only a upper GB mucosa and no bony erosion. So considering the depth of the tumor, it's a 7 millimeter. So considering the depth of the tumor, a decision was taken to do the supraomohyoid neck dissection. So today we have done the left supraomohyoid neck dissection with left upper alveolectomy. The disease was situated on the molar and premolar area. So the molar and one premolar teeth were removed, and alveolectomy was done, and the defect was closed with the left side nasolabial flap.